Welcome to our exercise progression. So we had a patient with an L5-S1 fusion. He comes to us 1 month post-surgery with the goal of returning to playing with his kids and returning to his job as an accountant. So this is the start of our eval. This is the subjective. So he presents to the clinic 1 month after the lumbar fusion. He elected to have the surgery because of over a year of severe back pain secondary to a spondylolisthesis. After the surgery, his physician told him to start a walking program, and so now he's able to walk about 15 minutes before getting fatigued. He does have spinal precautions, which is BLT, no bending, lifting, or twisting. Right now, he really requires help with lower body dressing, getting in and out of the shower, and household chores, and his patient goal is to play sports with kids again. So for objective, there were no significant system review findings. However, we did see that he does have stiff movement generally and then has limited arm swing during gait. He also has muscle guarding. His strength is listed here. You can see it's all a little bit weak everywhere. He does have tight hamstrings with a lack of 35 degrees in the straight leg raise test. He scored a 38 out of 56 on the Berg, which is a moderate fall risk, and a 60% on the Oswestry, which means there's severe disability. So the assessment, we said that he presents with nonspecific mechanical pain and stiffness in the low back following the lumbar fusion procedure. He has moderate irritability and good rehab potential, and those precautions, again, are no repetitive bending, lifting, or twisting for 4 more weeks. And these are the goals that we've set for him, and the main ones are that we want him to be independent with bed mobility in 2 weeks with normal time limit. We want him to be able to walk at least 30 minutes without an increase in pain within 4 weeks. And we want the Oswestry score to decrease to 20% or less in 8 weeks.
All right, so weeks 1 and 2 of therapy, which is also going to be weeks 5 and 6 post-op. So criteria number 1, we're going to start limited trunk flexion, extension, and rotation at 4 weeks or when the back brace is no longer required per your surgeon's orders. So for example, we want to introduce unloaded flexion in supine. So cardiovascular training, we obviously want to initiate a home walking program. So he was already walking 15 minutes, so we figured let's start at 20. And then you can also tell him that he can break those walks up into 2 10-minute walks as well if that is what motivates him. And then warm-up wise, we figured a nice UE ergometer would be good to get some core stabilization with some upper extremity strengthening as well. So exercise-wise, I'm just going to talk about a few of these. With knee fallout specifically, you get that introduction of hip dissociation from the trunk, and it also introduces core when you just have one knee up and the other knee coming out. And then spine-wise, we talked about multifidi, isometrics, and prone, as well as prone on elbows to start introducing some range of motion in the extension direction. And cool-down-wise, when it comes to stretching the hip flexors, we talked about doing that in the Thomas test position in order to avoid lumbar extension, which is going to be a little painful for him at this time. Education-wise, obviously no repetitive bending, lifting, and twisting. We just need to talk to him about how his spine is stable, it's healing. If he wants to get better, he needs to keep moving. And then position changes are important as well. So getting up and walking around when he's at work. And then also going back and checking to make sure that his log rolling is adequate at this time. Functional-wise, he was having problems getting in and out of the shower as well as lower body dressing. So we talked about starting with standing marching and then progressing through weeks 1, 2, 3, and 4 into lateral step-ups and just like changing the height of the box or the step. And then lower body dressing, we talked about just teaching him that figure 4 position in order to put on his socks and his pants. And this is the HEP. You may pause here if you'd like to read it.
Okay, so weeks 3 and 4 is weeks 7 and 8 post-op, and so we are going to increase the home walking program to 30 minutes total, and he can break that up if he wants to. And then for the warm-up, we are going to change that to 10 minutes on the elliptical. However, he's not going to use his arms, so we can avoid trunk rotation if that's painful, and there's going to be no resistance on the elliptical to start off with. For strengthening, For the core, we're going to start doing single knee to chest, and then throughout these 2 weeks progress to double knee to chest, and that's going to start introducing the flexion in an unloaded position, and then increase the time in the abdominal isometric holds. For the spine, we're going to introduce anterior and posterior pelvic tilts and modified cat-cows, modified for pain, and that's going to start to introduce extension in the spine, and then we'll teach him some nerve mobilizations. Lower extremity is going to become a little bit more functional with the sit to stands and the balance activities. And then for cool down, we're going to change the stretches a little bit to include open book, which will start to give some rotation into the spine and some light walking on the treadmill. And then education is pretty much the same thing from the first time, and there's the HEP.
So now we are at weeks 5 and 6 of therapy, which are weeks 9 and 10 post-op. So at this point, we decided to do a re-eval or follow-up, and he's reporting less pain with activities throughout the day. He has been able to participate in his children's life more, but still unable to throw the baseball in the backyard with his kids. He states he's been able to walk for 30 minutes around his neighborhood a couple times a week without increased pain. And he also states he's been very diligent in walking around for about 10 minutes every hour at work. So just some objective measures, we observed that he is less guarded with ambulation, and he has gained about 5 degrees of motion in his hamstrings. For outcome measures, his Berg has increased to 43 out of 56, so he's still in that mild to moderate fall risk, but we want to up him just a few more points. And his oswestry is now 34% disabled, and so we're still working towards that 20% goal. So again, he's had decreased pain levels and increased functional mobility. He's met several of his goals and still progressing on others. So some new goals, we want to continue to decrease his pain to allow increased general exercise and increase his endurance to exercise. Again, still work on that hamstring flexibility, the Berg, and the oswestry. So criteria number 2 for progression of exercise. So bone takes about 8 weeks to heal. So at that point, we're safe from that. So we can begin increasing weightlifting and working up to about 40 pounds by 6 months post-op. However, we really need to be sure that he's using proper body mechanics before increasing weight. So we want to make sure he's lifting with the legs, keeping the load close to him, and not falling into lumbar flexion. Cardiovascular training, we want to continue to maintain that walking program, encourage him to continue the frequent walk breaks at work as able. Also, we want to encourage him to increase the continuous time as tolerated. So right now he's able to walk about 30 minutes continuously, but we want him to continue to increase that time. For our warm-up, we have him on the elliptical again, but at this point we can start to incorporate the arms to get a little bit of trunk rotation and add a little bit of resistance. So for core strengthening, we decided to do Y's, T's, and A's to continue to work on that upper extremity strength and maintain that, but that also incorporates core stabilization. And to add a little bit of a balance perspective, we have him bouncing on the foam or a Bosu ball or something to challenge that. We also have bridges because they're a good overall great exercise. We can add a hold at the top and apply perturbations or leg lifts as we need increased challenge. For the spine, we have quadruped with basic support release, aka bird dog. You can easily progress that just by starting with just one limb and then going to contralateral arm and leg at the same time and holding. Low extremity, again, we're progressing to more functional activities. So we have squats. We can use the TRX to decrease trunk bend and make it more of a quadricep exercise. For step-ups with a kettlebell, so that puts a weight on one side, so you're having to use your core to stabilize you, and then the step-up is a single leg exercise, working on that balance perspective. And then again, just a little light stretching and cool down at the end. Education, just making sure he is aware of what he can and can't do. So yes, we're starting to increase some bending and twisting, just make sure he doesn't overdo it. And this would be a good point to just check in and make sure he's maintaining good habits at work as his pain decreases and he feels a little more confident in what he's able to do.
All right, so now we're at week 7 and 8 of rehab, which is weeks 11 and 12 post-op. And our criteria here is we want to have no overhead lifting more than 40 pounds for an additional 3 months or until 6 months post-op. And that's just from a couple of lumbar fusion protocols I could find. There's not a set standard for that, but that seems to be a general consensus. We need to keep going with the cardiovascular exercise. So continue with the walking program and trying to increase total duration or total distance. Just find a way that works best for him to track it. So if he's a time guy, working up to an hour plus daily, or if it's a total distance, at least 2 to 3 miles of total activity a day. When he comes into the clinic, we might be dropping down to about 1 time a week here for the last 2 weeks. Find a way to get him to do some cardio warm-up in his preferred state. So whether that's elliptical, stair stepper, UBE, or treadmill, it doesn't matter. Just get him on something for a little bit. And then in terms of motor control and strength, the core strengthening and stability exercises were from a systematic review on spinal stability exercises. Those included the following, all with TheraBand, and then the bird dogs and modified Roman chair were just with body weight. But there's a picture of all the exercises there, and then I'll keep talking about some of these here. All the exercises were done 4 sets of 12 and trying to find fatigue about that 10 to 12th rep. Then you want to look at some squat variations, and so you could do kettlebell on the ground, so like a sumo deadlift, and then you could work on doing a deadlift to lifting overhead. For something at home, if he doesn't have kettlebells, something like that, you could pick up dog food bags, something that just gives you a little bit of a less uniform consistency when you're lifting, so you have to stabilize a little bit more, and then work on any type of single limb work, so like a single leg squat or squat to a plinth or a chair and stand from that. Like Julie was talking about, you could do dumbbell step ups, just varying the height of the step or varying the weight of the dumbbell or the position of the dumbbell. The same thing with the carries. And then you could work on balance as a separate entity with just narrowing base of support, eyes open or closed, tandem, or toe taps like in the Berg, or you could incorporate that with the core strengthening and stability exercises. And then we still want to talk to him about transitioning out of those spinal precautions. Healing is continual and your spine is stable. Movement is still good, but we really want to focus on increasing aerobic conditioning and strengthening exercises, and to remember the lifting techniques, especially when lifting heavier objects. But you don't have to worry about it so much just around the house with your day-to-day activities. There's your HEP, continual walking, and with some of the exercises to progress them back into to discharge and into community exercise and participation. And then something to think about is return to high-intensity exercise, such as running. There's not really any guidelines I could find on this, and it seems to be that no one really wants to push the issue and return to those high-intensity exercises. But some things we do know to think about is around 8 weeks the bones should have healed, so that's something that we can take into account. And then other things you might want to look at, just like you would in maybe something like an ACL return to sport or something, is symmetry and the single limb work, both in strength and balance. Maybe you look at something hopping and jumping, see how that looks. Any setbacks with any of the exercises that we've had so far, like the walking program, the elliptical, anything like that. And we know that around 6 months they should be back to their prior level of function with no restrictions. And another thing we know is that these patients are typically underloaded, so that we might need to take a little bit more liberty, but you always want to be in communication with the surgeon to make sure you're not breaking any of their precautions. And a likely adverse event this is from a systematic review on complications after lumbar fusions, and just general readmission was the most likely, but only, I think, 4% of total lumbar fusions had to have a subsequent surgery and 1% had infection. So just general readmission to the hospital would be the most common likely adverse event. And in our PT, your response would be just to refer to the doctor and be in contact with the surgeon. And you might want to regress 1 week with your interventions just to allow for healing to occur. Thanks.
Sorry, couldn't think of a
It's
word.
okay. Just go back and say moderate fall risk and then finish that part
Okay.
out.
So he scored a 38 out of 56 on the Berg, which is a moderate.
Balance risk.
Balance risk.
Trust.
Okay.